I want to wish each one of you a warm welcome this evening. Thank you for coming out, and thank you for being here to be part of a new you. Who's excited for this next few days of health programming on a topic of a new you? I see a few hands. Awesome. I am really excited because the lineup of speakers and the topics we have, I think, are extremely relevant for our island community. And to start this evening's program, I'd like to invite Guam Seventh-day Adventist Clinic CEO, Mr. Victor Shepard, to just give a warm greeting here this evening.
Good evening. Buenas. I'm going to walk this side. Good evening. Buenas. Half a day. Good, great. I love it. How are you doing? Can I ask you a question? Do you like your appearance? Sometimes. I decided to do a little quick Google search, and here's what came up in my little impromptus, and it said the following. This data is coming from Advanced Dermatology. This is a group out of Chicago. It says Americans spend about $897 on appearance every year. Now, looking good is a priority for many, it says. And people will go great lengths to do whatever it is to make it happen. Now, this will greatly vary depending on age and gender. For example, it says women will spend around $1,064 per year on appearance. Males, you don't get exempted. You know how much you spend? No, much more than that. $728. So I ask you again, are you okay with your appearance? Now, yes? Good. I want to ask a little bit more, though. Do you feel good with yourself? Oh, yes? Okay, okay, okay. What about, would you want to have a new you? Okay, I got that. Good. On behalf of the Guam Seventh-day Adventist Clinic, it is my privilege to welcome you and everyone here to a New You conference. We are honored that you have chosen to spend this time with us. And here together, we are going to focus on the whole body, not only on appearance. That means with your mind, your emotions, your body, and your spirit. This conference is more than an event. It's an opportunity to learn. It's an opportunity for you to grow. It's an opportunity for you to be inspired towards living a healthier and more balanced life. Our goal is to share knowledge, practical tools, and encouragement to help each of you embrace positive changes, and for you to be able to experience the abundant life God designed you to have. We are grateful to our dedicated team, and that is, were you able to get a little massage? Yes? Were you able to speak to a physician, to a doctor? Were you screened? Well, if you didn't, you can just come tomorrow early, just about 6 o'clock, and you will be able to do that. So we also want to thank our partners, and we want to thank each and every one of you for being here with us. Your presence make this gathering meaningful, and together we hope to create a stronger and healthier Guam and in this community. May this conference be a blessing to you, and may you leave here renewed, may you leave here inspired and empowered to begin a new you. Welcome.
Thank you so much. I appreciate Mr. Shepard's comments and introduction. Welcome to the group. I want to take a moment to introduce myself and also to talk a little bit more about this whole idea of a new you, building off of what Victor shared. I'm Jonathan Thorpe. I'm an internal medicine physician and also lifestyle medicine physician at the Guam Seventh-day Adventist Clinic. I also have the privilege of wearing the hat of medical director. And so it's really an honor to work with such an incredible team at the clinic. I'm curious, if you don't feel uncomfortable answering this question, how many of you have or are patients, have been or are currently a patient at the clinic? Awesome. Good. Great. Well, we're so glad that we can serve you in that way, and we're looking forward to helping others who may need a medical home to also come and join us there too. This whole idea of a new you came out of the medical staff as we started talking about how can we better communicate the message that we do not need to be chronically ill. And I do not want to by any means take place of your personal relationship with your physician. I want to be very clear, this is a health education event. This is an opportunity for general health education. Any specific recommendations for your health that may be applied from this presentation needs to be in the context of your conversations with your physician. So please do not take this as treatment or diagnosis by any means. But I want to take a moment and step back in time. And I like to paint word pictures, so to speak, and so you can either keep your eyes open and imagine the word picture, or close your eyes and just imagine with me a beautiful, beautiful scene. Imagine that you are in a very lush, verdant, green environment. There is the sound of animals around you. There's birds that may be singing. There's animals that may be neighing or talking to each other. You look and you can see around you this beautiful array of colors, whether it be from the trees that are blossoming or from plants that are flowering. It's a refreshing, beautiful location. And in this spot, you have access to every type of imaginable fresh growing fruit, vegetable, root vegetable, tree fruit, etc. And your mouth is savoring that beautiful taste of some delicious plant that you are eating. Not only do you have the chance of eating some delicious food in this environment, but you also are with your best friend or friends, family members, and you're there fellowshipping, communicating, communing with one another. And in this environment, you don't have any electricity because you're outside, right? It's a beautiful spot outdoors. And so when it gets dark, guess what? It's time to lay down and have a refreshing night of sleep where there's no noise of televisions, radios, distractions of phones, etc., and you have the rejuvenation that comes from having a good night of sleep outside. I don't know how many of you have camped outdoors, but let me say I have my most refreshing nights of sleep when I'm outside enjoying that fresh air and that fresh scene. And in this beautiful spot, you're able to commune with one another. Your stress is relatively low because, well, you are out in nature. How many of you would like to be in that spot? I see almost every hand. I know I love those outdoor spots, and I think that there's glimpses, spots on Guam that probably represent this beautiful garden scene. And where I'm going to with this is that we, as the Guam Seventh-day Adventist Clinic, take the foundation for our health principles straight out of Scripture. And in Scripture, there's a beautiful scene described as the Garden of Eden, right from the beginning of time, so to speak, with where God created this earth, and He created each one of us. And in there, it says in Genesis 1:29, "Behold, I have given you every herb bearing seed, every tree yielding seed. To you it shall be food." Those are a little bit my words, but essentially that's what the passage is saying. The principles that we are speaking of this week are the pillars of lifestyle medicine. A number of us at the clinic are certified and boarded in lifestyle medicine, and there's some foundational pillars that we'll be covering this week. And I want to take just a very brief moment to introduce those and not to, so to speak, steal from our presenters who will be sharing more. But there's the pillar of nutrition. There's the pillar of physical activity. There's the pillar of rest. There's the pillar of social connectedness. There's the pillar of avoiding harmful substances. And there's the pillar of sleep. Those 6 pillars of lifestyle medicine is where the evidence from the science is that we can prevent, treat, and reverse chronic illnesses by using these basic tools. It's fascinating because when we look at the medical guidelines for so many different conditions that we as physicians follow, there's this little box at the top of the guideline that says lifestyle. And let me tell you, in 4 years of medical school and 3 years of fellowship, of residency, I can count on one hand the number of hours where we talked about nutrition, where we talked about exercise, where we talked about some of these different very fundamental core tools that we can use to prevent, treat, and reverse chronic illness. We as physicians are not generally educated in this area unless we take the effort to go and become trained so that we can follow that first box, because it tends to be easy to jump down to the second box and write the prescription and give you a pill or give some sort of treatment. But really, the science is clear that the lifestyle is the foundation for everything we're doing. And so this week, over the next 5 days, I'm thrilled that we could have presenters from the clinic. These are physicians, nurse practitioners, physician assistants, dentists, whom you may have been cared for by or may see in the future. We didn't bring in some off-island guest. No, we wanted to use people who are here, who know the cultural context maybe a little more. I've had the privilege of being here on this beautiful island for 5 years, and I'm beginning to understand glimpses of really what it means to be an island boy. I still have to say I like my cold weather more than the island, but it's okay. I'm getting used to it. The presenters will be talking about the new you. What is the science behind it, and what is where can we take our health as a next step? So for this evening, we're going to be talking about a new gut, because the gut health is vitally important for our overall health. We're going to be talking about new joints. We're going to be talking about new eyes, new heart, and a new brain. So you will not want to miss these 5 nights, because it's going to be a very engaging and I believe a wonderful experience for you to learn much. This evening's and every evening's presentation will be broken into the 3 key components. First will be a cooking demonstration by our registered dietitian, Candy Sim, who oversees all the wellness programs at the clinic. Then we'll be moving into an exercise demonstration. Let me tell you, you're not going to get to sit this evening. You're going to have to do some exercise, because exercise is so vitally important for our health. And then we'll be moving into the actual presentation. If I see anyone nodding off during the presentation, we might have to take a time out and do some more exercise, right? Or it's going to be an engaging, fun time. And then that will be wrapped up with some time for questions and answers. So please take your phones, take a piece of paper, write down questions you may have from any of the presentations, the cooking demonstration, the exercise demonstration, and or the presentation itself, and we'll be happy to help answer those questions for you at the end. Does this sound like a fun plan? Who's looking forward to it? Shall we get started? Awesome. I'd like to invite Candy Sim to come up and to start with the food demonstration.
All right, good evening, everyone. I'm Candy, and you probably won't meet another dietitian named Candy. I do have a friend who is also a dietitian. Her name is healthier. Her name is Cherry. So tonight, I want to talk to you about a quick fix for breakfast. How many of you rush out the door every morning and not have enough time to eat breakfast? You don't have to raise your hand. And so I wanted to show you a quick way to prepare your breakfast the night before, so that when you get up in the morning, it's right there in the fridge for you. Sounds good? All right, what if we can make this breakfast into kind of like a dessert as well? So I'm going to show you different ways to make this breakfast item. So I have here some nut milk. You could use soy milk or almond milk. By the way, the recipes, you can take a picture of this recipes registration booth in the front. We have it right there for you. And then so you have the nut milk here, whether it's soy milk or plant milk of any sort. You can actually make your own plant milk at home as well. Okay, so the ratio, if you have a nice blender, I'm gonna bring a blender tomorrow. A high-speed blender like a Vitamix is very handy to have it at home. It's a good investment to have it at home. And so if you wanted to make your own plant milk, the ratio is 1:7. If you use 1 cup of nuts of any kind or seeds, it would be 7 cups of water. Okay, so if you don't have time for that, you can use the store-bought. So I'm going to put this in. You can see there's oats and the milk already mixed in. And then what you wanted to do is just shake it so it mixes well. And you leave it overnight in the fridge. Don't leave it on the countertop. It's going to smell different the next day. So the next thing you wanted to add on as a sweetener is the maple syrup. So I'm adding this in. And to give some flavors, nice flavors, and to bring out that sweetness, you can add a little bit of salt, just a dash of salt. So let me put that in right here. And I'm putting in some cinnamon here. So the flavor that I'm making tonight is the apple cinnamon flavor. Okay? So you just shake it. How long did it take? Anyone time it? Probably a couple of minutes. That's all it takes. And you have a healthy breakfast. The next morning, you chop up some apples and put it as a topping. You can see here, right here, the toppings is the chopped apples. And when you're chopping apples, sometimes you have the juice from the apple. So don't toss it away. That's your apple juice, yeah? And you can add it as a topping. So for flavor, in this cup right here, I have chopped apples. You can add some maple syrup to sweeten it. And then for some nice flavor, a little kick to it, add tiny pieces of ginger. Okay? And it's a good anti-inflammatory ingredient here as well. And you can add some cinnamon. If you want a variation, you can use cardamom. How many of you know that? Yeah, you can find it in the spice section. And mix that. So I'm going to cover this up quickly and mix that well. And the next morning, you can put it on top. Okay? Now, there are other added nutrients that you can put in here that are high in omega-3, like flaxseed and chia seeds. And chia seeds has been really well with some liquid in there with your oats. So you can see that tiny little dots here, if you can see it well. Is it showing? Those are chia seeds in here. Or you can add some flaxseed. Another flavor you could do at home. How many of you like peanut butter jelly sandwich? Yeah? So you can use the same method on your oats. Put some peanut butter or almond butter, and instead of a jelly, just use some frozen strawberries or frozen berries or frozen mangoes if you want to. Yeah? Or you have local guavas when it's in season, and put it on top as well. Yeah? And then the other thing that you could do for flavor, instead of chocolate, you can look for carob chips. How many of you know what this is? Some of you. If you're not familiar with this, carob is a good substitute without caffeine for chocolate. Okay? So if you miss chocolate, you can use carob. So put some carrot chips. You can find this at Simply Food. Okay? And chopped bananas. Now you have, instead of bananas and chocolate, you have bananas and carobs. Sounds like a dessert by now? And then you can do blueberries with a little bit of lemon zest and a teaspoon of vanilla for a variety of flavors. So there's a lot of health benefits when you're eating this way. First, you get the nice, good source of fiber in the morning. And everything that we are using is whole food. There's no processed ingredient here. There's no sugar, not even brown sugar. Your sweeteners, the best sweeteners to use is actually dates or raisins, or you could use honey. Maple syrup is another option. And then for the protein, by the way, oats also have protein, but if you want to add additional protein source, you could use pumpkin seeds, sunflower seeds, almonds, pecans, walnuts. Walnuts is very high in omega-3 as well. I think one of the sessions we probably will talk about the benefits of omega-3. You don't necessarily have to get it from fish. It can come from plant source whole food as well. The next thing I wanted to cover here, one last thing, is the different kinds of grains. So besides old-fashioned oats, you could use steel-cut oats. Steel-cut oats won't work overnight in the liquid here. You would need an Instant Pot or a slow cooker to cook it overnight, and that will be a good source of fiber. If you have diabetes and you're worried about your blood sugar going up high after you eat oats, steel-cut oats is an option. And also barley flakes. Barley flakes is actual barley that has been flattened, and you can find that at Happy Mart. Yeah? So those are different options. Any questions about the recipes? We're going to pass out some samples so you can try it tonight. All right?
I don't know about you, but I'm hungry. Hungry for any one of those variations. Pretty easy to make, right? So super healthy. This is something that, as Candy said, a couple minutes in the evening can get ready for a healthy day. And we like to encourage a good, wholesome breakfast, because when you have your tummy full with healthy food in the morning, you're ready to go and go strong all day long. So after we eat, it's good to get some exercise, right? Bring down the blood sugar, help the muscles and the body absorb all the food we eat. So I'm going to turn over the time to our physical therapist, Dr. Isaiah Santos, for the next segment.
Good evening and half a day, everybody. This evening we're going to do a quick 5 to 7 minute exercise. It's very simple, doesn't require any equipment. You can do it anywhere, and it will help strengthen your muscles, improve a little bit of flexibility, and improve your circulation. So before we start, if anybody has any balance issues or maybe have any medical concerns, you might want to be careful with some of these exercises. We don't want you to have a fall or anything like that. But let's go ahead and stand up. We're going to start off with some marching in place for 30 seconds. This gets the heart pumping, helps with the circulation. Okay, get the knees high, a little bit faster. Slow it down. Very good. 10 more seconds. Especially after you eat, you always want to do some easy exercise to get the circulation going, helps with digestion. Okay, now we're going to do some heel and toe raises. So this is good for the ankles. Up on your toes and your heels. 10 times. Okay, up and down. This is very good for strengthening the feet, the ankles, especially as we get older. You know, sometimes we lose our balance, so this helps to strengthen our calves. And next, we're going to do another balance exercise. So if you have balance issues, you might want to skip this one. You're going to put one foot up like this, and you're going to turn your ankle clockwise 5 times. 3, 4, 5. So this is actually also working on your balance. Now, counterclockwise. 1. Yeah, you can use a chair if you need to, especially for the seniors. Okay, let's do the other foot. And counterclockwise. Okay, studies show that having strong legs is going to help us as we age, help us get out of chairs, help us climb steps. So we're going to do some squats. Okay, so there's chairs behind you, so just tap the chair, or if it's too hard, we can just do a partial squat. You don't have to go all the way down, okay? So ready, and squat. 2. 3, 4, 5, 6, 7, 8, 9, and 10. Great. Now, we're going to work on the flexibility of our trunk and our core. A lot of times when we sit, we get really stiff and we get back pain. So we're going to make some circles 5 times. 1, 2, 3, 4, 5, and reverse. 1, 2, 3, 4, and 5. We're going to do some extensions next. So stretch back. Just go as far as you're comfortable. 3 more times. One more. Okay. Next, you probably have seen people who sit in chairs a lot. Their chin kind of juts forward like this. That puts a lot of strain on the spine and the muscles in the cervical spine. So we do a lot of, I see a lot of patients with this condition, and so we try to strengthen the scapular retractors and bring the chin back. So one of the exercises is called a chin tuck. What we do is try to bring the chin in to the spine like this, hold it for a couple seconds, and relax. We're going to do this 10 times. 2, 3, 4, 5. Keep going. It's like making a little double chin. Or as one patient told me, you can imagine that somebody's trying to kiss you, but they have bad breath, so you're like, ew. Okay, so the next exercise is we're going to bring the shoulders, the arms back, hold it for a couple seconds, and forward. 2, 10 times. 3, 4, 5, 6, 7, 8, 9, 10. Next exercise is called snow angels. I guess we'd call them sand angels here in Guam. I grew up in Canada, so we used to play in the snow when I was younger. So, you put your hands up like this, and back, up and down 10 times. Try to maintain good posture. Eight, 2 more, 9, and 10. So we're going to do a couple of stretches next. So we're going to stretch the upper trapezius. You bring your head to the side. I'm going to hold it for 5 seconds. And switch. And 2 more times. One more. Okay, we're going to do one more exercise. This one is just to kind of improve our lung function. So what we're going to do, we're going to bring your arms out, take a deep breath into your nose, and slowly exhale through your mouth as you give yourself a hug. 2 more. Last one. Okay, thank you so much for participating.
I don't know about you, but I feel better already. It's so important when we use these different health principles. Not only are we renewing the different muscles that we may be exercising, but we're renewing our mind also. physical activity, good food, and it's good sleep, stress management, all renews our mind, which is super, super important. The frontal part of our brain, the frontal lobe, is where we make these really important decisions every day. And so part of what we're sharing this week will be helping us to renew our mind also. Our staff is passing around samples of the overnight oats. If you have any allergies, please ask Candy Sim maybe afterwards if it has any allergens in it. Please be cautious of this. At this time, I'd like to invite our presenters this evening, Dr. Brasaba and Ginger Haney, to come forward and to share with us a little bit more about this whole idea of a new gut. And the gut actually starts in the mouth. And so who better than to have Dr. Brasaba, a colleague of mine, a dentist, here to speak about how to create a healthy oral environment for our bodies so that we can renew our bodies and have a new you from an oral hygiene perspective. Dr. Brasaba is a dentist at the clinic, a father, and a globetrotter, so to speak. He was sharing his couple of favorite spots he's visited is the Masai Mara in Kenya and also the island of Palawan in the Philippines. And so, Dr. Brasaba, thank you for taking time to present this evening on a new gut, but specifically from the oral perspective.
Thank you, Dr. Torp. Good evening, everyone. So I'm going to be talking about the new you and new gut from an oral perspective. Some quotes that came to mind from the health reformer in 1871 says, "The stomach has a controlling power upon the health of the entire body." George Cuvier also mentioned the mouth is the mirror of the body, revealing general health problems. This one on the right I got from Instagram, and it says, "Did you know your gut health affects your smile?" So where's the connection? Well, gut health and our oral health actually are very closely related. Obviously, the mouth is the entry point or gateway to our digestive system and gut. And so a healthy mouth equals a healthy gut. So if you're looking at it from a dental perspective, poor dental health also will actually cause an imbalance of gut bacteria. And there was a study done in the Journal for Clinical Periodontology, which found that periodontal treatment or constant periodontal treatment or getting your teeth cleaned professionally can actually increase the abundance of beneficial bacteria in your gut. So how is this related? Connection between your oral and gut microbiomes. Basically, as we chew, the bacteria that reaches the digestive system via our swallowed food, drinks, saliva will go down from chewing into our gut, and then overgrowth of harmful bacteria actually comes back out to our oral, which can cause oral issues and a number of other issues which I'll explain. Does anyone know how many times they're supposed to be chewing their food, or average in terms of studies? 20 times? Anybody else? 30? Yeah, close, around 32 on average. So think about how many times you're chewing your food. Most of the time, I'm probably averaging 10, which is not that great. But you can get away with chewing softer foods, like watermelons or mashed potatoes, around 10 times or so. But anything on average is around 32. If you're chewing anything harder, like nuts or meats or steaks, you might have to go up to 42, and that will usually help. All right. One thing that we have to take note of, in terms of oral health, is periodontal disease. And I'm talking about periodontal disease because that's what I'm usually doing, diagnosing when I see patients. And we usually see when the first things we do when we check a patient is to check their gum health. And when we're doing that, we use this little instrument called a probe, and that's why you sometimes see your dentist or hygienist poking around your gums just to see how much pockets or the pocket of your gums or the bone in relation to the gums there. Normally, you have about 2 to 3 millimeter pockets around each tooth. When we get gingivitis, which is stage 2, you'll get a little bit of inflammation, redness around those gum tissues, a little bit of bleeding caused usually by the tartar or plaque bacteria that will accumulate around those areas. If that progresses, it can lead to periodontitis, and then stage 4, advanced periodontitis, which is the most severe form and the leading cause of tooth loss. And without our teeth means we can't chew. And without chewing, that will make it harder for us to chew foods that we need to eat, like fruits and vegetables. So why take care of your gut and oral health? Well, basically, we need to reduce our risk for a number of diseases like chronic disease, heart attack, and stroke, and dementia. One thing I found out actually was in a recent study was that in 2023, they found that there's actually an increased 2.363-fold increased risk for Alzheimer's disease with poor oral health. And so that related with tooth loss, dental caries, periodontal disease, gingivitis, and other diseases are associated with higher risk of Alzheimer's disease, which contributes to about 60 to 80% of dementia. And the main thing is that, like I was mentioning with that diagram earlier, when the bacteria goes back into our mouth, it's related to periodontal disease, which is linked to a number of other issues like rheumatoid arthritis, which a study found is related to periodontal disease. GERD, there was actually a study in 2010 to 2012 in Busan, Korea, where they studied 280 individuals with chronic periodontitis and then 280 individuals without chronic periodontitis, and they found out that the ones with gum disease actually had more GERD episodes compared to the ones that don't. Another one is inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease. And there's a study in 2020 that shows poor oral gum health causes the inflammation in the gums, which causes more inflammation in the stomach to worsen. Another main one that we see in the dental clinic is periodontal disease is linked to is heart disease, which can cause infective endocarditis, which is the inflammation of the inner lining of your heart. And there is a relation between a study that says about 30 to 40% of patients with infective endocarditis have oral bacteria identified in their bloodstream. And that's why majority in the dental profession, we will see a lot of patients where we have to do antibiotic prophylaxis for them and make sure to go through their history, especially with their primary care physicians as well. Another one is diabetes. That's a major risk for periodontitis, there's gum disease, and they found about a threefold increased case of risk of periodontitis for those with diabetes compared to those individuals without. Another one is lung, breast, and pancreatic cancer. There's studies that show that periodontal disease can cause an increased risk of lung cancer, especially for those that are smoking, as well as just an increased risk in general for breast and pancreatic cancer. So how can we prevent that? Basically, practicing good oral health. Brushing your teeth twice a day and flossing daily. Mainly diet as well, eating a diet low in sugar with plenty of water. And to go see your dentist or hygienist and get exams and get checks every 6 months. Another thing that's common is to avoid harmful habits such as smoking, because that's actually been linked to heart disease, lung cancer, 10 times increased risk of oral cancer, diabetes, and then it's led to worsening people's irritable bowel disease and Crohn's disease, and also betel nut chewing, which is also linked to oral esophageal cancers, type 2 diabetes, hypertension, and cardiovascular diseases. So, in summary, tips for healthy mouth and gut. Avoid abrasive chemical toothpaste, harsh brushing. That's why we also always recommend also to start using more of a softer toothbrush, especially for those that are brushing really hard because they're wearing out the enamel or outside portion of their teeth. And then, once again, reducing your sugar intake and processed foods, eating more gut-friendly probiotic foods like yogurt, leafy greens, sauerkraut, or kimchi, for example, and avoiding harsh chemical mouthwashes, as that can actually destroy the good bacteria in your mouth. And when you are doing these things, trying your best to get a healthy mouth, that leads to a healthy gut, and you're well on your way to getting a healthy body. And these are my references. And then I will ask my colleague Ginger to come up and share her side of the oral gut. Well, thank you so much for listening.
While our colleagues are getting the computer system working, I'm going to take a moment to introduce Ginger. So Ginger Haney is one of our physician assistants at the clinic, who is originally from Washington State And I was asking her, like, tell me some unique fact about her so that I could introduce her. And she was saying that she likes hiking, snorkeling, cooking, baking, etc. But then she said, I like diving into projects ranging from science and history to medicine, the arts, and get this. She even enjoys practical skills like figuring out how to reverse refrigerator doors so they open in the direction. I don't think I've ever met someone who likes to figure out how a refrigerator door can open the opposite direction. So I'm glad that Ginger can be presenting here. I think they're, as they are finishing getting that presentation up on the screen, I just want to come back to this whole topic of oral health and the importance of whole foods and why that is of benefit for our oral health. So as Candy shared here earlier, she gave a demonstration with whole foods for breakfast. These oatmeals, the overnight oats that she just shared is a good example of that. So what is some of the benefits of a whole food from the oral perspective? Well, number one is the whole foods are essential in a variety of very healthy nutrients for our body. So, for example, calcium and phosphorus. Many of our plants are high in these healthy nutrients such as kale and spinach, almonds, lean proteins are also excellent sources for this. Vitamin C, very essential. We've heard of scurvy, right? So the scurvy is an example of what happens in vitamin C deficiency. And our citruses, our fruits are high in vitamin C, another good source to help keep our teeth very strong. Are we good to go? Okay, good. I'm going to turn the time back over to Ginger to finish up the presentation.
All right, it's nice to meet you. Like you said, my name is Ginger. I'm a PA at the SDA Clinic, and I'm happy to talk to you today about the second part of A New Gut. So to get started, I was just a short, funny little story here. I was looking for a good diagram of the gut, and I couldn't find one I liked, so I decided, hey, I'm going to ask AI. I'm going to see if they can build me a diagram. I'll tell them all the different organs I want, and then it'll give me a good picture, right? So I hit go, and this picture came out. I was like, okay, it looks like everything's, you look down there, it's like, okay, all the organs are there, they're in order. Then I realized, oh, there's something wrong with this, or a couple somethings. Does anyone see anything wrong with this? Like the labels are pretty far off for the second half. I mean, mouth, esophagus, liver, and stomach, okay. This is not the gallbladder. This is definitely not the pancreas. This is not the small intestine at the end. And the colon is actually the whole thing. So moral of the story is don't let AI do the thinking for you. So this is a real picture of our digestive system, and just a quick overview of how it all works. Your food goes into your mouth. Your body puts out different enzymes like amylase to break down your carbohydrates as it goes down. In your stomach, you have stomach acid to start to break it apart, and the stomach kind of grinds the food into particles, so it works to break it down into smaller particles. As it moves down toward the small intestine, you get enzymes from the gallbladder and from the pancreas that help to break it down into even smaller molecules. As it moves through the small intestine, these are going to be absorbed and sent off to do their job in the rest of your body. Once the residue gets to your large intestine, there are a lot of bacteria there that are very happy to see it. So the bacteria get to work. They start fermenting it and break it down even farther. They put off molecules themselves and hormones that send signals to the rest of your body. And then when they're all done with it, it comes out the other end. So that's just a quick summary of digestion. And when we're talking about gut tonight, we're going to talk about mostly your large intestine, a little bit about your small intestine, but the large intestine. So the thing we're going to focus about in the large intestine is your microbiome. This might be a new term for you. And this is referring to all of the organisms that live in you and on you. So this includes bacteria, fungi, viruses, if you have parasites, and it can be in your gut, on your skin, in your mouth. All of our parts of our body have a microbiome. And interestingly, there are more organisms and cells in the microbiome than there are cells in the rest of your body. So we're more microbiome than we are human cells. Our microbiome starts early in life. We get our initial microbiome from our mother. When she has like a vaginal birth, we get that bacteria, and that's the first bacteria in the baby's gut. As the baby's getting older, as we get older, we get bacteria from other sources too. We get it from breast milk, we get it from our environment, so that pacifier that you put back in your mouth, or the dirt that you ate, or the animals that you were around, or the dust you were around. All of that helps to contribute to the microbiome. By the time we're about 3, your microbiome is fairly stable. It can be affected by different things as you go out through life, though. So one of the things we'll talk about a little bit later is lifestyle and how that plays a role. Your microbiome those bacteria, they produce substances that do affect the rest of your body. So this includes hormones, like serotonin and GABA, and it produces other molecules that help the immune system and help the gut barrier to be solid and keep out the bad particles that we don't want in our blood. Some vitamins are also produced. The microbiome is actually very well integrated with the rest of your body, and one of the ways that it's integrated is with circadian rhythm. So you may have heard of circadian rhythm. This is kind of overall directed by the suprachiasmatic nucleus up in your brain. It tells your brain how to operate on a 24-hour cycle. It tells you when to sleep, when to eat. It produces different hormones at different times. But the interesting thing is that it's mirrored all around the body. Your gut bacteria, they also have a little circadian rhythm going on too. And your body, it has to synchronize both of these. Some of the things that help synchronize it are, when you're getting your sunlight in the morning, when you're eating your meals at regular times, when you're getting your sleep. These things all help to bring the gut microbiome circadian rhythm and the brain circadian rhythm into balance with each other. The brain and the gut are interconnected. The vagus nerve is a highway of information between the two. And with your circadian rhythm, if one gets thrown off, the other gets thrown off. This can be, short and temporary, like when you travel across time zones, or if you're chronically working like a night shift, it does kind of long-term throw off your circadian rhythm because things just aren't in balance with what your body is designed to do. So moving on to the next one, another function that the gut has related to the microbiome is called the migrating motor complex. What this is it's a series of contractions down your gut, so starting kind of at the top, going all the way down to the end every 90 minutes, and it helps to sweep undigested food particles and extra bacteria and things all the way down to the colon, so to get it all out of the way from everywhere else. A nickname for this is also the housekeeper, because it kind of keeps everything clean. The migrating motor complex only happens during a fasting state, though. Fasting does not mean, you're not eating for 24 hours. It's anytime there is kind of a break there between your eating. So if you have your 3 meals a day, fasting would be in between your meals. And it would also be overnight if you're stopping at dinner time and starting in the morning. So this is actually very important because if it's disrupted, if our body doesn't have time to run through this, you can actually develop what's known as SIBO, or small intestine bacterial overgrowth. This is where there's extra bacteria in the small intestine and bad ones, and they affect our overall health. They can cause fatigue, brain fog, aches and pains, and a whole bunch of other symptoms. And so you can see that this migrating motor complex is really important, and supporting the body in doing that is really important. We did already mention the gut-brain connection. That vagus nerve is our highway up and down. So with this beautiful organism in the microbiome, it can go wrong, unfortunately. So I'm going to explain a little bit more about our gut. You can see in our picture here, we have our gut cells in the yellow, and then there's kind of 2 layers of blue. There's a closer layer, that's a mucus layer, and then there's a looser, farther layer. And these layers help to protect your gut cells from all the bacteria and all the things going on in your gut. When things go wrong, or if you start to have too many bad bacteria in your gut, this mucus barrier can break down. As it breaks down, the bad bacteria can get too close to your cells, and there's something on the bad bacteria that can start to irritate the cells and cause a chronic inflammation. So this inflammation is like your cells are very irritated in an unhappy state. As long as the microbiome is unbalanced, you're going to be having that inflammation. With the inflammation, your intestines can also get a little more leaky. It can start to let things through that shouldn't be going through into your bloodstream. And your body can tell that something's going on, and so your gut is sending out signal molecules to the rest of the body saying, hey, there's a problem here. This can result in symptoms like a lower energy level, fatigue, higher sensitivity to pain, depression, and it can actually interfere with the sensation of being full. Our body has some signals that it puts out in the gut and up in the brain, some receptors there that accepts these molecules. And when that gets interrupted, we might not know that we're full. We get off on that. We can't listen. Our body is not giving us good signals anymore because it can't. So you might ask, what causes poor gut health? So we're going to talk about 4 different things here. So the first one is more an interruption in our gut microbiome, are antibiotics. So antibiotics are wonderful things. They do a lot of very, very important jobs, and they're very important for many different things. But taking antibiotics that we don't really need, taking an antibiotic, just in case, that can actually be very damaging, because every time we take an antibiotic, it affects our gut, it affects our microbiome. It can really decrease the amount of certain types of bacteria in the gut, and then it can promote other types of bacteria. So maybe bad bacteria that are more resistant to this, they'll start to grow up a little bit more, and the good bacteria will be decreased and have it a more difficult time kind of regrowing and finding balance again. After a course of antibiotics, it can take a while for your gut to recover. It can take a few weeks. I think 2 to 3 weeks is average, but it can take sometimes, depending on the course of antibiotic and the antibiotic, it can take several months. It could even take a couple years. And sometimes your gut actually doesn't ever fully recover. And so while antibiotic use is very important, we need to be judicious with it and not take it unless it's absolutely necessary. So the next thing is when we eat. So, we talked about the circadian rhythm that our body is, that we're running under, and how we eat. Our body is designed for us to eat at certain times. The bacteria in our gut, they do their functions better at different times. They help our metabolism more during the day. They create more beneficial molecules called short-chain fatty acids during the day, which help support the gut lining. They help the immune system and several other functions. And so when we're eating at times that our body's not ready for it, it can start to throw these things off. So eating at abnormal times can damage the gut. Eating certain foods can be damaging to the gut as well. High-fat foods, which are largely our animal products and animal proteins, those can really damage the gut. They tend to promote the bad bacteria in our gut and diminish the good bacteria. They cause inflammation there in the lining of your intestines, and they can increase your risk of metabolic diseases like diabetes and obesity and things like that. When balances get off far enough, it can increase the risk of cancer as well. With this kind of diet, also, we're not usually taking in much fiber. Fiber is found naturally in your plant foods, so fruits and veggies, whole grains, beans, and things like that. And fiber is actually really important because it feeds the good bacteria in your gut. You might have heard the term prebiotics, so prebiotic, probiotic. Prebiotics is that fiber that gives the bacteria something to break down. It keeps them healthy, and it keeps our gut balanced in terms of good bacteria and bad bacteria. So we can damage our gut by having too much high-fat food and not enough fiber. And then the other thing that affects our gut is actually our stress levels. The vagus nerve, remember, that sends lots of signals. And when you may have noticed that when you feel very upset or stressed or angry, sometimes there's something kind of going on down here, whether you have a knot in your stomach or whether you just lost your appetite. That's because your brain is sending signals down to your gut. It's focusing on other things, and digestion is kind of being put on the back burner. Your digestion can actually kind of stop and stop progressing when you're feeling these really strong emotions. And another thing that you might feel is your gut trying to get rid of the food real fast. So it starts to contract more, and you might find that it's coming out faster than you intended it for to come out. So all 4 of these things can affect, in a negative way, our microbiome. So how can we improve our gut health? So it's largely the reverse of what we talked about. Being judicious about our antibiotics is very important. We don't give these out for colds. Colds aren't caused by bacteria, they're caused by viruses, like little machines. Antibiotics don't work for them. And so we don't give it out for that. For usually coughs that have only been around a few days, we don't usually give it off for that, because usually it's a virus, it'll resolve itself. But in the cases where we really do need it, let's go ahead and do it. But when we don't, let's be really judicious and careful about taking antibiotics. Talking about the circadian rhythm in eating, trying to eat in alignment with your body's circadian rhythm. So eating during the day, earlier during the day, supports better gut health, supports those microbes and their function. It allows them to do their daytime job of breaking down your food and giving you energy, and it also allows them to do their nighttime job of repairing like your gut lining and supporting your immune system. Eating the right foods. So as we talked about, these are going to be foods low in fat and high in fiber. You're going to give your bacteria all the good molecules to support all those good lines, and avoiding the ones that can damage it and cause inflammation. You could also consider adding some fermented foods, like your kimchi, your sauerkraut, or miso. You could consider adding like a probiotic, especially if you've recently taken a course of antibiotics. It can help to support your gut health at that point. So you can try adding some probiotics. But the baseline is going to be supporting those microbes with the healthiest food that you can give them, and lowering that inflammation and lowering that damage. Supporting the bacteria that build up that mucus layer so that our gut is very happy. And lastly, trying to keep your stress to a minimum, and avoid eating, when you're really having strong emotions. It's okay to maybe skip a meal here or there, put your food off until a little bit later, when you're not feeling as strong of an emotion. Fasting intermittently can be good. Overnight can be helpful with that and supporting it. And then, with our stress in our mental health, if you find that you're just in a rut, you're kind of stuck in a spiral, and you're constantly high anxiety, it's like, well, how can I eat? Because my anxiety's here all the time. I have to eat sometime. If that's you, if you find yourself there, it's okay, and it's actually good to reach out and maybe get a little support in that. When we help our mental health to come into alignment, it actually helps the rest of our body, and it does have a direct effect on the gut. So these are all the things that can affect our physical microbiome, and help prevent what we call dysbiosis, when it's all backwards. But what about some spiritual dysbiosis? So in our hearts, we all find that we have good tendencies and bad tendencies. Just like in our gut, we have good bacteria and bad bacteria. And we can start to find ourselves out of alignment with these good and bad tendencies. The Bible speaks to this in Ephesians 4:31 and 32. And it says, "Let all bitterness, wrath, anger, clamor, and evil speaking be put away from you with all malice. And be kind to one another, tender-hearted, and forgiving one another, just as God in Christ also forgave you." Now, talking about that mental health aspect, not only are all of these going to be supporting our mental health and giving us, through good mental health, good gut bacteria, but they're also going to be helping us spiritually. They're going to be supporting us in walking in the good way, in treating others kindly. And sometimes with our gut, the balance can get off so far that we need an intervention. It's similar in our spiritual lives. ability to do these things by ourselves can seem impossible, and it really is impossible because of our environments, because of the sin that we're born with. But the key to overcoming that is here. Christ came and he walked on this earth and he didn't sin. He was able to resist all of these negative things and overcome at the cross. And so he can give us that. Because he overcame on earth, he can overcome in us, and he can give us that power to overcome. And so I want to encourage you, look at the balance in your own life of good and evil, of good and bad, as well as looking at your gut. And let's work to be balanced in all things, in our gut as well as our spirit. Thank you.
Thank you. I don't know about you, but I learned several new things this evening. I want to invite Dr. Santana, my colleague, up. I recognize that we're a few minutes past the bottom of the hour. If anyone needs to step out, please feel free to do so. You will not hurt my feelings at all. But I wanted to ask Dr. Santana, my co-internist at the clinic, what are 3 things that you learned this evening? And while he's getting ready to answer that question, I want to ask each of you to be thinking maybe of a question you have either for us or for one of our presenters. So, Dr. Santana, what was 3 takeaways that you had from this evening's presentation?
All right. So, number 1, back in the year 1928, there was a man by the name of Alexander Fleming. Can anyone tell me what Alexander Fleming discovered? Penicillin. Of course, Dr. Salas, thank you. Our infectious disease doctor. All right. Arguably one of the most amazing discoveries that saved the human race from premature death. The problem is that we as physicians and also many patients expect, I got a little cold, I go see my doctor, he gives me antibiotics. And if he doesn't give me antibiotics, he's doing a bad job and he's not a good doctor. And we get this thing in our mind, I don't give antibiotics for viral colds. Any one of you who are my patients, you know this. Most of us don't. Why? Because of what Ginger talked about. It does more harm than good. And so I just wanted to make that bring that point in. Don't be asking your doc for antibiotics when they are not indicated. Your doctor most likely will give them to you if you have a life-threatening infection or an infection that does require a bacterial treatment.
So the first takeaway you have is being very careful with the use of antibiotics so we don't wipe out our good bacteria.
Right.
Okay. As you're getting ready for the second one, anybody have any questions that we can start? I can start migrating your direction to get ready for you to ask. Okay, Dr. Santana, give us another takeaway.
All right, another takeaway. It's incredible how our gut is tied to our mind. So any given patient comes in and has some GI issues. Maybe it's some upset. Maybe it's some persistent diarrhea, constipation. I just don't feel good, doc. It's always bugging me. Something going on. One of the things we look for is, wait a second, what's going on up here? Right? Because there are some issues that the patient may not tell you right away, but you have to kind of dig a little deeper. So you go into things like post-traumatic stress. Some of you have heard about this, PTSD, severe anxiety, some sort of childhood trauma. And if you handle that, many times the GI upset or the abdominal problem will go away. So I just want everyone to keep that in mind as well.
Beautiful. It kind of comes back to that point that Ginger shared on the last slide there, where Christ intends to remake us, and a lot of times our physical healing is because of something deeper. Right. And many times it's spiritual healing that we need also for full health, for full renewal of our minds and our bodies. Third takeaway.
Third takeaway. One thing that Ginger mentioned that was very important, your gut, the microbiome in your gut is on a clock. It's called a circadian rhythm. Many people don't realize that when they eat late, their growth hormone does not peak. It peaks more or less around 10 p.m. or so. This is our feel good. This is our the newness of life. This is the repair hormone. It's so important. There was a whole movement a few years ago about growth hormone. Movie stars were going to get growth hormone injections because that was the fountain of youth. Well, our own bodies produce growth hormone, and if you eat late, that circadian rhythm doesn't happen, and your growth hormone does not get produced to its peak, right? And so if the growth hormone doesn't peak, then it affects your cortisol in the morning. So everything is tied. So one of the things she mentioned, which I think is very important, is don't eat at night. That was one of my takeaways for tonight.
Awesome. Any questions? Anyone with any questions this evening? I'm happy to come to you and you can ask the question. Coming to you in a second. It's easier on the front row, not the back row.
What is the cutoff time for eating at night?
Good question. Is there any science behind the last time that we should be eating?
So the recommendation would be more or less 5 or 6, about 4 or 5 hours before bedtime. So if for most people your growth hormone peaks around 10 p.m., 5 o'clock would be a good time to have dinner. Great question.
Next question.
What shall I do if I feel hungry during the night?
What do I do when I feel hungry during the night?
All right. So the big question is, why are you feeling hungry? And is it true hunger, or is it just a habit that you've developed over time, right? Because if you had a good dinner, there's no technical reason why we should be hungry at nighttime. I don't know if you had something to add to that.
I was going to say it starts in the morning time. So as we shared with that delicious recipe on how to make overnight oats, when you eat a fiber diet, guess what? Your body is filled with a lot of roughage, and the stretch of the tummy, the stretch of the intestines occurs, and you don't feel hungry as fast. And so eating a high fiber diet is one of the best steps to combating hunger throughout the day. And yes, our bodies are creatures of habit. So if we're used to, sitting down in the evening and quotes relaxing with some food, careful now, because we're eating too close to dinner time. Our feel-good hormone, the growth hormone, is going to be shut off, and we're going to mess up the cortisol in the morning time, and we throw off our gut bacteria. So we train our bodies to say, I'm hungry at night, when in reality is that you're probably not hungry. It's more that you're used to. You have a habit of eating the munchies. But start off the day with high fiber. Going to be good to go for us today. I recognize we're getting late here. Maybe one more question.
I remember when Dr. Nedley was here, he said that rolled oats has a high level of melatonin in it.
That's such an interesting point. I'm going to ask Candy Sim if she's here still. Candy? I don't think she's here.
I can say a little bit on
I don't know,
melatonin.
but do you know?
Yeah.
But from rolled oats specifically?
Oh, for rolled oats, I'm not sure.
I don't know. That's a good question. Thanks for stumping me this evening. Yeah. Interesting. So let's talk about melatonin, because there's a lot of science behind melatonin.
A quick little melatonin, we know, is that hormone that helps us to sleep, right? But melatonin, and I learned this recently, melatonin helps repair our gut lining. So this is one of the things that Ginger was talking about, right? Our immune system, we used to think it was just our white blood cells that would come in when a virus or something enters. Our white blood cells come and they're the first ones there. No, it's actually our microbiome. That's the first one that comes to our aid. The second is the gut lining. So melatonin actually helps repair your gut lining, and it's every 3 to 5 days that you get a brand new lining. So it actually indirectly impacts your immune health.
And also the importance of sunlight in generating melatonin.
Correct.
So the low frequency waves of light, outdoor light, penetrates through clothing, and it penetrates through our entire body. And I recently learned that every single one of our cells in our body produces melatonin as a powerful antioxidant to protect and to fight against all these insults that come against our different cells. And so being outside, being exposed to sunlight, even if you've got clothes on, is vitally important to generate melatonin through our entire body. We used to think it was only in our brain, in the pineal gland, which help regulate sleep. And it's true, that's part of the sleep mechanism, but it actually has a much greater effect on that.
20 minutes of morning light.
20 minutes of morning light. It helps with the
best.
sleep and everything. Thank you so much, Ginger and Dr. Brasava, for your presentations this evening. Can we give a round of appreciation for them? Who was thankful they could do some movement and stretching and exercise this evening? I was, and I know that I was thankful that I got to see a food demonstration, but somehow I didn't get a sample. I hope it was good, because I've been talking about this all evening. Was it good? Awesome. Very good. We're looking forward to inviting you to come back tomorrow night. This whole week, we're talking about a new you. We're looking at it from organ to organ to organ. We've touched on just briefly this evening on our oral and gut health by making these healthy food choices, by using things like making sure that we're eating at the right time of day and maintaining our sleep and exercise, that we can help renew our gut, which renews our mind. And as we go through the week, we're going to be talking more and more about this whole concept of mind renewal. And we're going to be sharing an important announcement as the week goes on about renew of the mind also. So please bring a friend and come on back again tomorrow night starting at 6 o'clock. There'll be physicians and health professionals here to answer questions, a health screening, and then the same event tomorrow. But we're going to be focusing on our joints. I know many of us have creaky joints, and so please come back again tomorrow evening. Bring a friend. We've got some empty seats here this evening, so bring a friend, and we'll see you tomorrow evening. Let's close with a word of prayer, and then we'll be able to wrap up. Heavenly Father, thank you for these principles of healing that you have given to us, and I pray that what we have learned this evening will be taken to our gut, I guess, and that we'll be able to apply these on a daily basis to better our health. So please bless each individual, keep them safe as they return to their homes. I pray in the name of Jesus. Amen. Have a good evening, everyone. Thank you so much.